Nobody warned me. That's the part that still gets me, even now. I spent 32 years as a registered nurse. I watched doctors, sat in on rounds, read charts, handed out medications, held people's hands through the worst days of their lives. And when my own body started changing after 60, quietly, without dramatic symptoms, without anything I could point to and say this is wrong, I still didn't know the things I'm about to tell you. Because nobody tells you. Not your doctor, not your annual physical, not the pamphlet they hand you in the waiting room with the cartoon of a smiling senior taking a walk. I'm 84 years old, and I'm telling you this because I wish someone had told me. The first thing you need to understand is that the body doesn't announce what it's losing. It just loses it, quietly, over years. And by the time you notice, the window for easy correction has often already closed. Take muscle. By the time you're 65, which feels young to me now, believe me, the average person has lost roughly 30% of their muscle mass. 30% gone, not from disease, just from time and disuse. There's a name for it, sarcopenia, but you've probably never heard it because it almost never comes up in a routine appointment. Nobody orders the scan that would show it. You walk in, they check your cholesterol, your blood pressure, they tell you everything looks fine, and you walk out. Meanwhile, your muscles have been quietly disappearing for years, and you don't find out until you fall, or you can't get up from a chair without pushing off the armrests, or you fracture something, and the rehab is brutal because there's nothing left to build back from. I had a woman I used to work alongside. I'll call her Rita because that's not her name, but she deserves the story told. She was a nurse for 28 years, smart woman, took care of herself, she thought, walked her dog every morning. She fell getting out of the bathtub at 71, hip fracture. What followed was 18 months of her life that I don't think she ever fully got back. And what I kept thinking was, if someone had measured her muscle mass 5 years earlier, if someone had looked at what was actually happening in her body instead of just the numbers on a standard panel, there might have been time. That's the thing about falls. 1 in 3 adults over 65 falls every year, and falls now kill more seniors in this country than car accidents. But here's what nobody mentions in the same breath. 80% of those serious falls happen inside the home, not on icy sidewalks, not on hiking trails, in the bathroom, in the bedroom, and a grab bar, a properly installed grab bar, which costs maybe $200 installed, cuts hip fracture risk nearly in half. That's not a study I'm misremembering. That's real. And most people never put one in until after someone they love has already fallen. We wait for the evidence. We always wait for the evidence. Now I want to tell you about something that happened to me personally. And I don't say that lightly, because I'm generally not someone who leads with her own story, but this one matters. After my cancer treatment, I had colon cancer, stage 3. I was 67, and that experience changed the way I think about every single thing that goes into my body. I started paying much more attention to my nutrition. I mean serious attention. I changed my diet completely, anti-inflammatory, high-quality food. I cooked almost everything from scratch, and I still developed a B12 deficiency. That one took me by surprise, because I was eating well. The food was there. But after 60, your stomach produces significantly less hydrochloric acid. And what that means in practical terms is that your body absorbs up to 40% less B12 from food, even from perfect food, even from a perfect diet. The acid needed to extract B12 from protein just isn't there the way it used to be. And the early signs of B12 deficiency are terrifying if you don't know what you're looking at. Memory fog, tingling in the hands and feet, balance problems, fatigue that feels different, heavier than normal tired. I had a patient years before my own diagnosis, a man in his late 70s whose family had already started researching memory care facilities because they were certain he was developing dementia. He wasn't. He was severely B12 deficient. 6 weeks of treatment, different man. His daughter called me crying. She kept saying, "We almost put him somewhere." That's the part that should stop you cold. How many people are sitting in memory care right now for something that could have been tested and corrected? And this connects to something broader that I need you to hear. 70% of people over 60 are walking around right now with at least one undiagnosed nutrient deficiency. 70%. And the reason it's undiagnosed isn't because it's hard to find. It's because standard blood panels don't look for it. Magnesium, vitamin D, zinc, B12. None of these are on a routine panel unless you specifically ask. Your doctor is not withholding anything. They're ordering what the standard protocol calls for. But the standard protocol wasn't designed around what older bodies actually need. So you have to ask. You have to go in and say, "I want a comprehensive micronutrient panel," by name, because what you don't test, you cannot fix. I know how that feels for a lot of people. You don't want to seem like you're being difficult. You don't want to take up too much of your doctor's time. I understand that impulse. I spent decades on the other side of that desk. But I'm telling you, the 15 minutes it takes to have that conversation could change the next 10 years of your life. Now I want to stay with something for a moment that I think gets dismissed too quickly: loneliness. I know that sounds like a soft topic compared to muscle scans and blood panels, but the data on this is harder than most people realize. After 60, chronic loneliness raises your mortality risk by 26%. That's not a small number. That matches, statistically, the damage of smoking 15 cigarettes a day, every day. And Harvard researchers found that just one meaningful face-to-face social interaction daily, not a text, not a scroll through social media, actual face-to-face, measurably lowers inflammation markers and cortisol levels within weeks, which means your coffee with a friend is doing something chemically real in your body. It's not just nice. It's medicine without a prescription. I think about this a lot with Walter. My husband has dementia now, mild but progressive, and the social world we used to navigate together has changed shape completely. There are days when I'm the only person he's really talked to, and I make sure I'm not the only person I've really talked to. Because I've watched what isolation does to people at the end of their lives, I've watched it in patients, in neighbors, and the ones who kept one foot in the world, even when the world got smaller, lasted longer and with more of themselves intact. That's just true. I've seen it too many times to believe otherwise. Here's something I want you to hold in the back of your mind as we keep going, because I'm going to come back to it. The medications, the ones you're taking right now. because there's a story attached to that, and it's not the one you've been told. The average 65-year-old in America takes between 4 and 5 prescription medications daily, and fewer than 30% of pharmacy visits include any real drug interaction check. Not because pharmacists don't know how, they do, but because the system isn't built to stop and do that unless someone asks. Bring every bottle, every supplement, every over-the-counter pill, every vitamin. Bring all of it to one pharmacist once a year and ask for a full interaction review. Not a quick glance, a real one. Because combinations that cause dizziness, confusion, and falls hide in plain sight on medicine bottles that look perfectly ordinary sitting in your cabinet. I've seen this. I've seen people written off as declining when it was actually a drug combination doing the damage. I'll come back to the medication story, but first, the brain. Your brain shrinks roughly 5% each decade after 40. That sounds grim, and I understand if you need a second with that. But here's the part that changes everything. A landmark study found that just 6 months of brisk walking 3 times a week reversed up to 2 years of age-related brain shrinkage. Reversed it, not slowed it, reversed. And you don't need a gym. You need shoes and 30 minutes of daylight. That's the whole prescription. Walking. Actual walking. The kind where your heart rate comes up a little and you're aware of your breath. Only 28% of adults over 65 meet the CDC's minimum activity recommendation. And the minimum is 150 minutes a week, which is 21 minutes a day. We're not talking about training for anything. We're talking about 21 minutes. And those who meet that number cut their dementia risk in half. Half! And reduce their chance of hospitalization from any cause by 40%. The best exercise for someone over 60 is whatever exercise they will actually do consistently. Not the best exercise on paper, the one they will do. Next week, and the week after that, and in February when it's cold, I walk 30 minutes every single morning. I've done it for 15 years. I started the year after my cancer treatment, and I have not stopped. I walk because I watched what the absence of movement does to a body over time in a hospital. You see it happen fast when people are bedridden. Muscle disappears in days. The lungs get lazy. The mind gets foggy. The body was made to move, and it will remind you of that every time you stop. Now, water. This one is unglamorous, and I want you to pay attention anyway. Dehydration is the #1 hidden reason seniors end up in the emergency room. #1. And the reason is specific. After 60, your thirst signal weakens dramatically. By the time your body tells you it's thirsty, you are already clinically dehydrated. Already. The signal is late. It was always perfectly calibrated when you were young, and then slowly, without telling you, it started lagging behind. Chronic low-grade dehydration mimics confusion, dizziness, and fatigue that doctors routinely attribute to aging, when the answer is water. Get a water bottle with time markers. Drink before you're thirsty. This is not a minor tip. People have come back from what looked like cognitive decline because someone caught the dehydration. I've seen it. Now I need to come back to the heart, because this is the one that makes me want to stop strangers on the street. 80% of heart attacks in people over 60 present with no chest pain. None. What you feel instead is jaw ache, sudden crushing exhaustion that comes out of nowhere, nausea, what feels exactly like bad indigestion. And so you take an antacid and you wait and you talk yourself out of it. Women over 60 are especially prone to these silent presentations. They dismiss it. They wait. They don't want to make a fuss. And by the time they call 911, the damage is irreversible. I want you to memorize this. Jaw ache, sudden extreme fatigue, nausea, what feels like indigestion that comes on fast. If those appear together, especially if they feel different from your normal, call. Don't wait to see if it passes. Call. I need to tell you about sleep because this is where I see people make a mistake that costs them for years. After 60, consistently sleeping fewer than 6 hours raises your risk of Alzheimer's disease by 30%. 30%. And what do a lot of people do? They take sleeping pills, which dramatically increase fall and fracture risk. I understand the appeal. Sleep is hard, the nights get long, and something that promises relief is hard to resist. But there are changes that work without that risk. Your bedroom temperature matters. 65 degrees Fahrenheit is where most people sleep deepest. No screens for 1 hour before bed. Same wake time every single morning, weekends included. Your brain is a clock. It needs consistency more than it needs extra hours. And your mouth. I know we don't talk about teeth enough. Gum disease after 60 is directly linked to a 70% higher risk of heart disease. 70! Because the bacteria from inflamed gums enter your bloodstream and accelerate arterial plaque directly. And most Medicare plans still don't cover dental care, which means millions of people are skipping cleanings that literally cost less than $200 and could change the trajectory of their cardiovascular health. If you are choosing between dental care and something else, please don't choose the something else. Hearing. I want to finish with this one because it's the most underestimated thing on this entire list. Undiagnosed hearing loss doubles your risk of dementia. Not slightly raises, doubles. Because the brain is burning cognitive reserves just trying to decode speech, instead of forming memories, instead of processing and storing. It's spending its energy on something it can no longer do efficiently, and everything else suffers. Modern hearing aids are nearly invisible. The test itself takes less than an hour, and it's one of the single most protective things you can do for your mind after 60. I have a friend, real person, not a patient, who resisted for 4 years because she didn't want to feel old. 4 years. When she finally got AIDS, she told me she had forgotten what it felt like to just listen to something, to not be working so hard. She cried on the phone when she called me because she'd been exhausted for years from something she thought was just aging, and it wasn't. That's the word I keep coming back to, that word, aging. We use it as an explanation when it's actually a category that covers a lot of things that have specific names and specific fixes. Not all of them, not everything, but more than we've been led to believe. Go back to your doctor. Ask for the tests by name. Bring your bottles. Install the bar. Walk. Drink the water before you're thirsty. Get your hearing checked. Call your friend. Your body is keeping score right now. It has been for years. And most of what it's tracking, you still have time to change. If something here gave you pause, something you recognized or something you hadn't thought about, I hope you'll share this with someone you care about. These aren't scary statistics, they're invitations. Drop a comment and tell me which one surprised you most. I read every single one. And if you haven't subscribed yet, please do, because this is exactly the kind of conversation I think we need to keep having.